Hello, hello, everybody. Ta-da! First dose. Hooray! I'm just so excited. Alrighty, I think almost everybody's here. Well, let me go ahead and do attendance real quick, and then we'll go ahead and get started. I have just like a teeny bit of stuff left over from last week, and then we'll start talking about how psychologists get involved in police departments. All righty. I don't even know what that sound was on my computer. What do you want, computer? Oh, you know what? I know what it was. Google message. Cool, cool. All right. So, as I mentioned, I have a little bit of stuff to go over from last week. Just a little bit more about antisocial PD that I didn't get to cover. And then we'll start talking about policing. Hello, Simba. I'm upstairs. You can come up here. He's being very vocal downstairs because he doesn't know where I am. So you might hear him in the background. I'm also just pulling up the syllabus to check in on things. Yes, so tonight by midnight, and again, I'm taking everything late all semester, but in theory by midnight tonight, get in your plan. And remember, there is a place on Blackboard for this. And this is your site description. You've already turned in your plan. So this is the actual site you're going to volunteer at. So if you're still ironing that out this week, that's fine. But get this into me as soon as you can, just because that means you'll know and you can start getting everything going. So some sites, and some people are already running into this, will require you to do more hours than are required by our course. If it's a place you're interested in volunteering anyway, great to go ahead and get set up, and you can get whatever training and whatever you do this semester for the class. If that's not something you're able to commit to, definitely we can find something else that'll work for you. One thing I think I also shared with at least one person is that in the past, when people have had a hard time finding places or like didn't have cars, what they've done is done stuff on campus for another organization. So like contact an organization, find out what supplies they need, and do like a supply drive for a battered women's shelter or something along those lines. So that's another option. And I've had groups of students do that together too before. Again, I'm always open to any questions, concerns you all have. So always feel free to email me, or you all are learning how to set up appointments with me, so you can always do that as well. After that, your next thing that you'll have due is the end of next week, the questions you're going to ask your person you're going to interview. And again, that's just to get you thinking about that. So again, try to keep yourself on that schedule if you can. Again, I'm being really understanding if you can't. But also, this is to help you not get behind. The whole reason I constructed it this way is in the past, people have tried to leave it all towards the end of the semester, and it's just too hard to do everything then. So I'm just trying to help y'all build to it. Alrighty, well, I am going to go ahead and start with the little bit I wanted to tell you all last week and didn't get to. So this is really interesting. So this is actually a book written by, it's not too blurry, Jonathan Kellerman, who's actually a mystery writer. He writes mysteries about a psychologist who consults with the police department. And he himself is a PhD in child clinical psychology. And so he is a professor of pediatrics. He, or was, he may have retired now because he's probably rolling in dough from all his mysteries, let's be honest. But has worked with kids with cancer, things along those lines. And this book is called Savage Spawn, Reflections on Violent Children. So one thing we kind of brushed over last week when we were talking about Dexter is that, yeah, this can start pretty young. And you can see this in, you know, kids 7, 8, somewhere in that area. And so he, as a child clinical psychologist, wrote a little bit about this. So this is talking about kids who have antisocial traits or tendencies. Again, you can't diagnose someone with antisocial personality disorder until they are 18. But certainly there are kids who have these traits. So this is not to say, oh, there he is. Hi, Simba. Not to say that all children with violent tendencies are psychopaths. But young psychopaths comprise a substantial portion of the children who devolve into serious habitual criminals. And what criminals they become: the cruelest, most calculating felons, blithe killers, strong-arm virtuosos, industrious career miscreants, viewing crime as their profession, unfettered by conscience or convention, or the thought of distant punishment as they wreak misery and pain on the rest of us. They're not spurred by poverty or rage against one machine or the other, though these factors may play a role in their development. They do it because they love it. They do it because they can. Prison keeps them away from the rest of us, but once they get out of prison, the recidivism rate is significantly higher than those of other released convicts. They don't stop being bad because they don't want to stop being bad. So there's one bit, and then the other bit here. When confronted by spectacularly grotesque expressions of psychopathy, we engage in armchair psychiatry, mouthing seemingly logical platitudes such as, "They're crazy. You have to be crazy to cut off someone's head and freeze it, or mutilate a 10-year-old, or shoot up a schoolyard." Defense attorneys capitalize on this, but it's a lie. You don't have to be crazy. Psychopathic killers are anything but crazy. Insanity, a legal term rather than a medical diagnosis, varies in definition from state to state. But all concepts of insanity have in common the notion that the insane criminal suffers from a biologically mediated inability to distinguish right from wrong, and or an inability to assist in his own defense. Psychopaths know exactly what they're doing. Sometimes their motive is nothing more than the alleviation of boredom. They get bored easily. So I just thought that was a really interesting perspective, again, from someone who is a child clinical psychologist, has worked with kids who have these tendencies, and just sort of gets at the heart of the fact that, like, we just tend to dismiss things like school shootings, right? That's the most common thing. Oh, he was mentally ill, he was crazy. People who do these things often have calculated them out, right? The shooters at Columbine had a very detailed plan. You can't do that if you are not in your right mind at the time. You just can't. So it's an important thing to distinct. And I think that's just also like a good thing to think about in terms of inclusivity. So we tend to use terms related to mental illness really dismissively, like, oh, so crazy, or, oh, I'm feeling a little OCD today, right? Like, it's not a thing. Those are actually diagnoses that people have, right? And so I think that's really important that as students of psychology and other related disciplines like criminal justice, that, and I fully admit, I've been guilty of this at times too, like, oh, that's insane, right? But like, we try to check ourselves, just like we check ourselves if we were using a slur or we were using non-gender inclusive language, right? That like, okay, it's not cool to make, mental health an insult, right? It's no different than making something wrong with your physical health an insult or a taunt. So that's my little soapbox for the day. I am going to be toggling between two different screens today. Let me get Simba off my keyboard so he doesn't mute me. The first one is a PowerPoint, and that's posted, and I believe the handout that's related to it is also posted. So I'm gonna turn over to the, it's okay, dude, it's just a motorcycle going by. It's fine. He's very concerned. He's blocking my view. There we go. So I'm going to share the PowerPoint first, and then we'll be toggling back and forth with a handout about how evaluations of police officers go. And so, like, before I dive too much into this, I'll just give a little explanation. So psychologists get involved in the officers' lives really at two times. One is at the beginning. So most municipalities, when you're applying for some sort of law enforcement position, be it local, state, federal, what have you, you are going to have to go through a psychological evaluation. And so this will usually include an interview and some assessment instruments. And so that's a big piece of it. The second way they get involved is psychologists who are either consultants for or hired by police departments, who help officers who are, traumatized in the field. Maybe they were shot, injured, saw their partner killed, something along those lines. And so they might provide therapy, and or they might be the one responsible for evaluating that person and seeing whether they are fit to go back to work. So those are the two types of situations they're going to be in that we're going to talk about. And so now I'm going to do my getting set up to stand up thing. Alrighty. So, and then let me share screen. Okay. So again, not the world's best PowerPoint, but should hopefully be helpful to just make it so you don't have to write down all the terms. Pull down the chat in case anyone talks there. All right. So when we think about the job of a police officer, what do we think about? So if I were to just ask you, what do police officers do? What are the first things that come to your mind? You can either type in the chat or you can unmute.
They protect and serve.
Mm-hmm. Protect and serve. So trying to protect those from crime. I mean, I'll be 100% honest. My first thought when I think of police officers is speeding tickets, right? It's not fair, but it is what I think of. Oops. What setting did you find there? All right. All right. He took me to some setting I've never seen before. It was fun. 12 jobs at once without the proper education. Yes. Arrest people. Yeah. Police officer jobs are actually really complex. And typically the police academy is like 6 months. And you don't always, it depends on the municipality. You don't always have to have a college degree to be an officer. Some places want you to, some places don't. So you can imagine only having 6 months of training for a job as complex as enforcing the laws, like knowing the laws to enforce them, right? They're kind of like lawyers and security guards and like a whole bunch of other things all in one. And again, as I did at the beginning of the semester, I want to fully acknowledge that there are major things wrong. It's not broken. It was set up this way, right, with our current policing system. So some of the history of our current policing system in the States, and there are problems worldwide too. I'm not going to be like, it's just us, but are that some of the way our law enforcement still exists now came out of these type of groups being set up to capture runaway slaves. Okay. A lot of it comes out of a history of policies that were inherently and still are racist, classist, sexist, ableist, right? Heterosexist. I could go on and on and on and on. Xenophobic. If you think to even just our Constitution, right? The fact that like slaves were considered 5/8 of a person because the people in the South wanted some credit but didn't want to give them full personhood because then they couldn't justify owning them, right? These are all really problematic things. And there are very well-intentioned individuals, and I know that I've had students even recently who still want to go into law enforcement, who think of this as a noble career, who want to do good by doing it. And just like any other job, there are really crappy people who profit from the way the system is set up in a flawed way, right? And take advantage of that. And we see that every day. We see all kinds of people who get away with things, right? So I just want to fully acknowledge that before we dive in. And I fully recognize for a lot of you in this class, it may be really difficult to have empathy for someone who chooses this as their career. Fully acknowledging that. So part of the challenge of being someone in the mental health field is to see the inherent worth and dignity in every person, whether that person is a serial killer, whether that person is a police officer, whether that person is someone who just spat in your face, right? And so that's sort of the challenge we have for ourselves here. And I come at this from a really weird angle, admittedly, because I have all the empathy and rage that I can have as a white ally for what's happening, but I also have friends and family members who are members of law enforcement. So I definitely have this like push-pull dichotomy, and I've called those officers on their crap sometimes, right? But then I also recognize that there are times that one of my good friends who's an officer says, my main goal is just to get home to my kids at the end of the day. He has 2 little girls. So that does not justify anything that has happened, any of the murders that have happened, but again, like helps us to see them as people. And again, recognizing that they are not all psychopaths or horrible people. And in fact, part of what we're going to talk about today is how we try to screen that out, right? But that they benefit from this really messed up system. And again, it's not broken. It was set up in this really unfair way. So just putting that out there and acknowledging the push-pull of this. So here's what they actually do according to research and how stuff breaks down. So enforcing the law, keeping things like making arrests, only accounts for about 10% of what they do. Maintaining order, so doing things like directing traffic, things along those lines. So if you've ever been to like a concert or baseball game and there are officers directing traffic afterwards, that's part of their job. And then providing services, so things like helping stranded motorists. That accounts for most of police activity. And again, it'll depend on their exact position, their exact job description, how much of what they do. So selection of police officers, like I said, this is one of the first ways we get involved as psychologists. So psychological evaluation of police actually started in 1960. So there was a scientist named Terman, and he tested 30 applicants for police and firefighter jobs. And that's something else I should say, is that oftentimes firefighters and other people who are going to be in these sort of high-risk jobs also go through psychological evaluations. So he published this in 1917, and he found that the average IQ among these applicants was 84. The average IQ in the population is 100, and the standard deviation is 15. So they were just below 1 standard deviation. So not awful, but sort of interesting, right? And he recommended that no one with an IQ below 80 be accepted for these jobs, just because of the level of intellect he felt that it required. And so here was the first like psychological component. We're talking about cognitive ability, right? We're talking about intelligence. In the 1960s and 1970s, several different national commissions, like the 1967 President's Commission on Law Enforcement recommended formal psychological association of police personnel in all departments. So by the 1990s, these formal assessments had just become routine. It was just, you're applying for this job, this is what you do. And one thing I should note here is that, like, this is part of the job application process, but also it's sort of weird how they navigate it. So technically, because of anti-discrimination policies that do exist and laws that do exist, you can't make a psychological evaluation contingent on hiring someone. So oftentimes what they do is they've gone through the initial screening, they're hired, and then they go through this and some other things as well. And then they would just be let go as a condition of this. So they have like a conditional employment at the time they're evaluated a lot of the time. So psychological evaluation is not likely to identify ideal candidates, but it can be used to screen out those with specific problems that would interfere with their effective functioning as police officers. All right, so in terms of requirements for the psychologists, they have to be licensed in the state that they are practicing. So, you know, if I wanted to do evaluations in North Carolina, I would have to get licensed there. Even though it's, you know, just an hour away across the border. Not even. So they should meet the minimal qualifications for a professional psychologist. And there are guidelines for that, not only in the law, but also that the American Psychological Association provides. So they have to be licensed. They have to be thoroughly trained in assessment procedures so they can offer evidence of adequate training or experience in the area of psychological test interpretation and psychological assessment techniques. Now, if you are a psychologist with a PhD or often even a master's in clinical psychology, you are going to have this training. So my first year of grad school, I believe I took 3 classes that were entirely about assessment. And then in the following years, I took 2 or 3 more in addition to actually doing the assessments and being enrolled in like separate practica for the assessments. So you are trained well in this if you are a clinical psychologist, because the very first thing you do, whether you are seeing someone for one of these evaluations, seeing someone to come in to be a therapy client, is you are going to assess them. So every single person you see as a clinical psychologist, you have to know how to assess them. So you have to have a knowledge of the research literature related to psychological screening for police. So not just the research about assessment or the research about like forensic psychology. You actually need to know the research and the current literature, because stuff changes all the time as new data comes out about what are the proper procedures, what do we need to know about how well these things work in screening for police. So you've got to stay up to date. And a lot of times, not only through reading published articles, but also through continuing education workshops, psychologists will stay up to date on this. You also need a working knowledge of each of the following. So the Uniform Guidelines on Employee Selection Procedures is a set of procedures that have been outlined for this process. And so if you're going to be doing these evals, you better know what those say. So basically what I'm already getting at, which I hope you all are picking up on, is that you just don't go in and be like, yeah, I'll figure out whether you can be a police officer, right? There's a huge set of like very prescribed things that are recommended for psychologists and actually sort of like mandated, required. So this is what you should be doing. You also need a working knowledge of the Americans with Disabilities Act, which talks about discrimination against people with all sorts of disabilities, including mental disabilities. and associated fair employment issues. So, what are your state's regulations about fair employment? You can't just dismiss someone because they have an anxiety disorder, right? And you don't like people with anxiety disorders. There need to be concrete reasons why you think that these psychological issues would get in the way of this person performing their job as a police officer. You also need a working knowledge of the regulations issued by the EEOC, and that is a body that works on equal employment opportunities regarding psychological and mental disabilities under the ADA, that American with Disabilities Act. So not only do you need to know the law, you need to know these updated regulations related to the law. You need working knowledge of the pertinent APA guidelines covering psychological testing. So Division 18 of the American Psychological Association is the Psychology and Law Society, and they issued their own guidelines about doing this. And they are called the Recommended Guidelines for Pre-Employment Screening for Law Enforcement Officers. So they're very specific, right? But again, making sure you're up to date on that. You also need to have firsthand knowledge of the peace officer or the potential law enforcement agent's job as it is performed in that agency. So typically psychologists are asked to do a ride along, talk to people in the department so they know exactly what that person will be doing. And they can include that in their analysis of whether this particular applicant is a good fit. And you have to be, let me see if I have, there we go. Yep. How those, you also have to understand the job-related criteria the agency is interested in measuring and how those relate to psychological assessment procedures, and also like how those criteria translate into the job, right? You have to be willing to testify in court to the validity of your screening process. So let's say someone doesn't get hired on your recommendation. They might sue the department and also you, right? So as you do your assessment, as you write your report, you better be darn sure you can defend every single thing that's in there. And this is going to be a common theme we talk about throughout the semester as we talk about other types of psychological evaluations you do here. So whether you're doing an evaluation for whether they're not guilty by reason of insanity, or to see if they're competent to stand trial, or a child custody evaluation, you have to write as if every grammatical mark, every word you use could be picked apart by an opposing attorney in court. So when people are like, why do I need to know about writing for psychology? You got to write. No matter which psychology job you're going into, you got to write, right? If you're a researcher, you're going to write up research reports. You're a professor, you're going to do that. You're going to write up other things as well. You're a clinician, you've got to write up reports and notes for your sessions. If you're doing assessments in these formal settings, you have to write them so well that they should be inimpeachable, that anyone can pick that up and not have any ways to poke holes in what you did. So as part of that, it requires that you have a working knowledge of the law surrounding the screening. And again, that might vary from municipality to municipality. An understanding of those assessment instruments, those tests, specifically as they relate to employment selection. So for example, I know a lot about the MMPI. I was really heavily trained in that when I was in grad school. I know this much about how you apply it in this scenario. So I would need a lot more training were I ever to try to do one of these. And then you also need data supporting the validity of the screening process as conducted by the agency. So previously published research or maybe some data that you have collected. Also, you have to be able to relate effectively to individuals throughout the agency. And that includes the person in front of you, right? If that person doesn't trust you, they're not really going to open up. You have to be able to relate well to field training officers and to top level administrators who may have been behind a desk for years. So it's you use a lot of your clinical skills just in interacting with the people who you're reporting to. And that you conduct in-house education programs with all staff members. They will understand the limits of psychological screening. You know, I'm not going to be perfect, and there are only so many things I can pick up on. And then you're responsible for the conduct of anyone you're supervising who's helping you with these. So let's say I'm a PhD person and I take on a master's level intern to help me do these. Just as if I was doing it myself, I better be darn sure they're doing everything exactly right, right? So whether that means training them until you feel competent, or whether that means actually sitting in on the interviews with them, whatever that means, to make sure that those services conform to the APA standards. So this is a lot, right? This is a lot. Doing these is not a cakewalk. Doing these is something that's a challenge. And I think the psychologists who take it on do it partially because of that, right? And because of their passion for trying to get the best people into these jobs. But there's a lot of things you have to remember and know and kind of balance in your mind as you do these. So I don't mean to like deter anyone from doing these, but also just sort of fleshing out that it's a lot more complex than we see on TV. Let's put it that way. All right, so here is where I'm going to flip on over to the handout. So let me do a new share. Okay, so these are the psychological evaluation guidelines. And I believe these may have been updated since they were originally published, but the general gist would be about the same. So basically, these are part of what you'd have to follow as a psychologist doing these. And again, this handout should be posted on Blackboard along with the PowerPoint for this chapter. So basically, you have to recognize that this is only one part of the process. Any good psychologist will know that, but you have to impress that upon the people who request them from you too. Again, you have to be familiar with the research literature, all of these good things. You need to be licensed or certified, have the experience in psychological test interpretation, and specifically, again, these types of assessments. So you should know the data about the most important issues or attributes for performance in that particular position, right? So if someone is coming up to be a beat cop, right, that might be different than if they're trying to be a detective. And keep that in mind as you do the assessment. And you get that from the job analysis, interviews, surveys, or whatever else you do. You provide administrators with information regarding both the benefits and the limitations. So those are those in-house trainings we just talked about. And you have to make sure the test material is secure. So not only is it copywritten, right? And so that's the whole thing, but also the ability of us as psychologists to keep using the same tests for these types and other types of evaluation is partially dependent upon those things remaining confidential, right? So if I were trying to do these and I just handed the person the test book for the MMPI and said, take this home, it's fine. And they made copies of it and distributed it to all their buddies, right? That's on me, right? I'm the one who messed up test confidentiality. I could get in trouble for that. I could lose my license for that. So you don't do that. You also want to make sure that you have maintained the security of the raw data. So their scores on things, maybe their Scantron sheets, and also your report. So your report, just like any other time you're operating as a psychologist, should only go to the people it's supposed to go to. It shouldn't be something you accidentally attach as an email, right? And send to the whole department. So you have to be very careful, and oftentimes a psychologist will like password protect or encrypt their files as well if they are going to email them. And then prior to actually doing the interview and having them take the psychological instruments, the candidate has to understand things. So what do they have to understand? Why they're doing this test, who this person is in front of them, and then how that information will be used in the report. Perhaps the most important one is the fact that nothing they tell you as a psychologist is confidential. Because even though they are sitting across from you in your office, or these days on Zoom, right? They are not your client. Your client is the person who hired you, which is the department. So your report will go to the appropriate person in the department, regardless of what they say. You know, I've sometimes had one of my friends who is a police officer come and do like a guest lecture and Q&A when I teach this part. I didn't want to ask him this year because, again, he has 2 small children and there's a lot going on with COVID. But one of the things he's talked about is actually, I'm sure it applies to psychologists too, is that he's talked to like the, and I think of it, the lie detector test guy, and said, you know, like, why do we still do these? We'll learn in a couple of lectures that like, there's actually not a lot of validity behind them. And the guy said, it's actually like when I'm strapping them in and getting them all hooked up that I get the most information. Because they'll be like, well, you're not going to ask me about this. Right? It's the same thing with the psychologist, right? Once they send that consent form and they're like, well, you're not going to ask me about whether I murdered anyone, right? You have to be like, what? Tell me about that, right? And so that's really important for them to know. All right, so the test battery, again, can't just be anything you threw together, can't be your own thing if you don't have research behind it. It's got to have objective, specifically job-related, well-validated psychological instruments. And then they often recommend that the evaluator see those results before they do the interviews. And then any test that you're doing should not just be validated in general, so have research support behind it, but be specifically validated for use in this particular situation. So validated for use with people who are applying for public safety jobs, law enforcement, firefighters, etc. If you are doing remote testing, which is, again, more of a reality than ever now, they have to verify and interpret the individual results, and you have to make sure you treat that as if they were in the room with you, right? More and more, a lot of these tests are being put in a digital format, so people can do like the MMPI on the computer, for example. And as I mentioned, ADA guidelines, and this conditional offer of employment has been tendered. And then some personality tests and other methods of inquiry may be conducted at the pre-offer stage. They aren't the evaluation in and of itself. So this would not actually be the formal psych eval. They might just give you something, again, weird analogy, but I go from my own life. When I applied to work at Kohl's when I was in high school, I had to fill out a personality questionnaire, like, how are you at multitasking and things like that, right? So it might be some, you know, more formal version of that. Now, during your interview, you want it to be face-to-face. You have to include this in a report. Just assessing someone with a pencil and paper or computer-based test does not in a psychological evaluation make, because as the evaluator, you get so much information from being in that room with that person, right? You can pick up on anxiety cues. You can pick up on like whether they seem to be taking care of personal hygiene, right? Like, are they with it enough to find your office? All those things can go into play. There's usually semi-structured interviews, so it tells you which questions to ask them. So you ask all candidates the same questions, and then you can follow up. And then you should give yourself enough time to do this, right? Like a good interview is going to take you at least an hour. For something like this, probably longer. So you want to, make sure you have that scheduled block. And again, talking about the test results with that person. In terms of the evaluation itself, you only give the report to the person who is essentially the hiring person, or if there's a committee, that. So you are evaluating how suitable that person is for that particular job, right? So again, if they're applying to be a beat cop, you're not evaluating them to be a detective, right? Can they do the job that they are being asked to do, or they are asking to do, I guess that's an applicant, based on the job criteria that exists there. So you want to include all the psychological material, so not just the test results, not just the interview, everything. And they should have some sort of rating or recommendation for employment. And different agencies will have different ways they want you to do that. Some won't want you to come right out and say it. Some will. But there are obviously always ways you can hint at it. Like, there are some concerns about XYZ, right? Is a nice way of saying, like, I probably wouldn't hire this person. You have to justify the recommendations. And if there's anything that calls into question the results, you need to say that too. So, you know, they were trying to take a test of concentration and the fire alarm went off, right? You need to say that, things along those lines. Or, you know, this person's, you know, father was in the hospital after just having had a heart attack when we were talking about this. So I think that, you know, maybe some follow-up should be done. So you don't diagnose them. You don't label them with having a disorder or a disease, because all you're really giving a yes or no recommendation, right? Yes, I would hire this person. No, I wouldn't. It doesn't matter if this person has depression, anxiety, right? If they're like someone with antisocial PD, we probably don't want to give them a gun, right? But you wouldn't say that diagnosis. You would say all the reasons why you make that recommendation. So you're focusing on, can this person do this job? Not what's their diagnosis, what pathology may they have or not. So unless there are like really explicit research results showing this, you shouldn't just be like, anyone who scores above this on this test can't be in. You should really make a well-rounded decision based on all the information you have. So clear disclaimer should be made so that the reports are deemed valid after a specific period of time. So you want to say in your report, this is only good for X amount of time. If that person, you know, has something called into question 5 years in the future, your results are probably not going to be relevant anymore, right? Because probably a lot has changed in that person's life, particularly if they took on this law enforcement job and have seen, you know, perhaps traumatic events out in the field. In terms of follow-up, you only are using these for pre-appointment decisions. So if they want more information, you would have to do follow-ups. You shouldn't say, oh yeah, that application's fine if they decide to switch jobs, right? You would have to do another one or like rewrite your report. If there was like a fitness for duty question, you shouldn't use the same report. Each agency should sort of analyze whether they're being discriminatory. Is it that the people who are being denied are always people of color? Is that the people who are being denied, there we go, are always women, right? You need to keep track of that. And the psychologist may be part of that because of our training and data. And as I mentioned before, they should be prepared to defend their procedures even in a court of law. So that becomes important as well. All right, that was a lot of words. So questions about anything we've covered so far here? All right, awesome. And like I said, the handout is posted on Blackboard. All right, so now we're going to talk about each of the assessment techniques in more detail. Yes, okay, good. So I was like, is that my only slide for this? No. Okay. So the 3 types of techniques we want to be using in doing these evals are the personal interviews, the observations of candidates and situations that reflect real world police work, and those psychological tests we've mentioned. And we'll go through each of those in more detail. All right, so the interview is widely used, even though we can fully acknowledge that interviews can be probably the most susceptible to distortion or personal bias of anything that you would do during this process. But it's still just so important clinically to get to know that person and have them just be numbers on a page. It's also really useful for orienting candidates to the evaluation. So, you know, explaining to them this process, explaining how everything will be used. And there are 2 types of interviews. So they're unstructured and structured. And then, as I mentioned, there's sort of like a hybrid in between the semi-structured. So unstructured interviews are what you would typically do in a clinical setting. They're things like, tell me what brought you in today. Tell me about your previous psychiatric history. It's a way of gathering a lot of information and also observing any nonverbals about what's going on with that person. So let's say you're interviewing someone who comes in for a job offer, and every time you ask them about substance use, like drinking or using drugs, they change the subject, right? They haven't actually answered your question, but they kind of have, right? Like that avoidance in and of itself is instructive, and you want to make sure you circle back to that. The structured interview or the semi-structured interview is one that is written and standardized and has research behind it. And you ask them formal questions and you read the questions. So I have the SCID mentioned here. That's an example of a structured interview. And this is the structured clinical interview for the DSM. This is something you do in clinical work to help with diagnosis. Certainly you wouldn't use it in one of these evals because you're not looking at diagnosis, but everything is scripted. So like when we were doing this in my grad school, I would do my unstructured interview and then we'd flip over to this. And I would actually tell my clients before I started, okay, now we're gonna flip to something that's scripted. So my words and the way I'm talking may sound different to you. Please know that I'm doing this for standardization purposes. And people were pretty cool with that. You also might do what's called a mental status exam, which are a set of questions and observations that evaluate awareness. Basically, do you know who and where you are? So like, if I asked you who you are, if I asked you who I am, if I asked you the time, where we are, why you're here, do you know that? Look at attention span, memory, judgment, things along those lines. So again, part of this might be informal throughout your interview. And then you might ask like actually scripted specific questions for this. So situational tests are very, very cool and probably underutilized, I would argue. So one example is the foot patrol observation test, as it says on this slide. So they use tests similar to those done by officers on the job. They are designed to predict performance in the academy and then further once they graduate from the academy on the job. Not surprisingly, there's evidence that these tests are better predictors of job performance than other measures because they're the closest to what they'll actually be doing, right? The problem is they are time consuming and they're expensive. So for that reason, they're unfortunately only used by a minority of police departments. So typically what we're using is psychological tests. And there are many standardized psychological tests that have good reliability, but in particular, again, you want to make sure they work for this population, right? You can have the perfect test, but if it doesn't have any research behind it saying it works for these types of evals, you don't want to throw that in there. Again, you're going to need to be able to stand up in a court of law and argue why you did these things. So there might be tests that look at cognitive or intellectual ability. So you might do something like memory tests, attention tests, things along those lines. But typically what we're looking at is tests of personality traits. There might be psychological tests looking at things like integrity or emotional stability. Intelligence test scores are only weakly related to actual performance in the field, so we tend not to give those, especially since those are pretty time intensive. So one personality test that was designed for this purpose, it was designed for these pre-employment screenings, is the Inwold Personality Inventory. And in particular, this was developed to try to identify psychologically unsuitable law enforcement candidates. So to keep people out who, again, we shouldn't be giving a gun to on the streets and just letting go ham, right? So it has 310 items, it's true false. So that sounds like that would be like take you forever, but because they're true false, you can probably do this in about a half hour. It is empirically derived for law enforcement settings, and it was developed specifically for these types of assessments. And there are 26 behavioral subscales related to specific things in law enforcement functioning. So guardedness, alcohol, drugs, driving violations, job difficulties. I'm going to skip through some of these because y'all know how to read, but you can see there's an antisocial attitudes one. There's one about phobias. There's one about unusual experiences or undue suspiciousness, spouse-mate conflicts that might interfere, right? So 26 different scales that can give you good data that you can take into account while making your responsibilities. There's also an empirically derived risk rating that you get. It's like one score based on all these subscales as to how risky would it be to hire this person as a police officer. Inwold himself developed that. There's a lot of good research behind it. Another commonly used one, and really the most widely used personality inventory in a lot of different assessments. So you're going to see this pop up in clinical assessments. You're going to see this pop up in child custody evaluations, not guilty by reason of insanity, what have you, is the MMPI. And so the MMPI, this is the data for the MMPI 2 that I have on here. Just last semester, so I believe I took the training for this in November, they came out with the MMPI 3. So people will be shifting to that, but if you're talking to interviewees this semester, they're most likely still going to be using the MMPI 2. So I wanted to tell you all about that. And if anyone's particularly interested in the MMPI 3, I can certainly bring that information later in the semester because I took like a 7-hour training on it. So I'm pretty well versed. So the MMPI 2 was 567 items. Subsequent versions have been shortened for the sake of efficiency, but I do have to say we gave this to every client who came through our training clinic. And for the average college student, this would only take them about 45 minutes to fill out because they're all true false. If you leave it blank, whether it's on accident or on purpose, it's coded as cannot say. And they have a whole bunch of scales as well, just like the Inwold that we talked about. So there are clinical scales that assess symptoms of disorders and personality traits. A really important piece of any eval you're going to do in this psych in the law setting is the validity scales. And they tell you if that person is trying to look good, look better than they are. So for example, one of the items on one of those scales is like, I read the whole newspaper cover to cover every day. 0 people do that, right? What, you're reading every classified ad and every advertisement? No, right? So you're just trying to make yourself look good, which like is understandable if you're trying to get a job, right? But we want you to also be honest. Some example of other MMPI items are, I'd rather win than lose in a game. I'm never happier than when alone. My hardest battles are with myself. I'm sure I get a raw deal from life. Evil spirits possess me at times. No one knows, but I've tried to kill myself. Most people make friends because friends are likely useful to them. Not surprisingly, that last one comes from the antisocial attitude subscale, right? It was developed using a method called empirical keying, which is really counterintuitive. So in these upper level classes, I like to take a minute to talk about it because it's a really interesting process. So in order to do this, you gather lots of items, just questions or statements you want people to respond to. And they can be from many different places, and they're often from previous tests. And now actually, if people are trying to create a new scale and do empirical keying, now a lot of times they pull items from the MMPI to do that. Then you give those items, you administer those items to people already divided for groups. So for the MMPI, they had people they knew were diagnosed with schizophrenia, for example. And then they compared these people's answers to those of a control group that was supposed to be non-pathological. So then you compare these answers, and the items endorsed by the schizophrenic group, but not by the control group, make up the schizophrenia scale. And the test makers don't care what the content of the items is. One of the original authors of the MMPI used to brag that he hadn't even read all the items on it. And so, for a long time, the first item on the MMPI was, I enjoy reading mechanic magazines. What? What? It had empirically keyed onto something. Then you do cross-validation, and you take that scale, you've created all those items that people with schizophrenia endorsed, but other people didn't, and you give them to a new sample. And if the people who score high on that are actually the people who have a diagnosis of schizophrenia, you're doing great. It's ready for use. If not, you would repeat and re-hone it. The MMPI, maybe not surprisingly, had some problems, especially with the original sample. So I mentioned that the control group was supposed to be non-pathological, but they collected this data and did this research in an inpatient mental facility. And the controls group were the people who came to visit, the people who were there. So you have family members, right? And we know that a lot of these disorders are genetic, right? And so probably not as clean of a sample as they thought it was. They were also all from Minnesota, which particularly at that time was white Scandinavian, mostly farmers, right? So there was a geographical and an ethnic bias. And so in 1989, they did the MMPI-2. They got new norms, a much more representative sample, and they called it the restandardization product because that was their primary focus. They introduced new items to create new subscales that could inform about important things. And because the MMPI at that point was starting to be used for these types of job screening evals, they went through and removed items that were illegal to ask as part of a job screening process. The 2RF was published in 2008, and it was built off the creation of what they called the RC, or the restructured clinical scales. So it was meant to get at the core meaning of those clinical scales. And what they did when they went and looked at the research is that they found there was a core component in all those clinical scales that came as an artifact, essentially, of the empirical keying. And that was what they ended up calling demoralization, or essentially distress. Not surprisingly, if you are someone with a mental illness, you have an element of distress if you're coming in for treatment, right? That's what's going to motivate you to get treatment. So that's now its own scale. It's called the RCD. And that has been maintained for the 3. The 3 is essentially just like an updated, better version of the RF. So it's shorter. They made sure there's no overlapping items at each level of interpretation. They used factor analysis. There's a lot of research that has gone in. They have all kinds of different standardization samples, including standardization samples specifically for evaluations like this. And so, again, cleaner, better. I feel like I'm singing the Daft Punk song. Harder, better, faster, stronger. There we go. Alrighty. And just quick note on the MMPI, the reason I know so much about it, I don't have this slide in here, but I typically mention it, is Jack Graham, who helped write the MMPI-2, and Yossi Ventura, who is the co-author and of the MMPI-2RF, and actually the lead author of the MMPI-3, were my grad school professors. So it was actually really cool when I did my training in November. It was with Yossi, and I hadn't taken a class with him, I think, since my second year of grad school. So that was really fun to learn from him again, because he has a really nice, clear style. All right, now we're going to start talking about, oh, real quick, sorry, I keep jumping ahead because I'm so excited. So thinking about, and I'm just going to sit for a sec because it's going to help me get through this bit, but thinking about, okay, so I've got these two personality inventories. We've got the INWALD, which is very specific to the situation, and we've got the MMPI, which has a lot of great research behind it, right? But was created for a very different type of situation. So research suggests, shows that the IPI has good reliability and is predictive of how well someone will do on the job, significantly better than that of the MMPI. And again, probably not surprisingly, since it was developed specifically for this scenario. Research has shown that both of these are related to subjective and objective indicators of performance 1 year later. Things like ranking by their supervisor, items from their record, like reprimands, complaints. But the IPI scores exhibited stronger relationships. The IPI correctly classified 72% of officers, and the MMPI rate was 64. So both good, but the IPI is obviously better. Honestly, in these evals, you might give both. So you have different information you get from each. In terms of these type of evaluations, we know that there are positive relationships between these results and between performance by police recruits. So doing these evals is good. They've also gathered peer ratings from trainees. So they had the trainees rate each other member of their class, and found that the ratings do correlate with job retention of police officers, but not other measures of job performance. And maybe part of retention is just how much you get along with your coworkers. That makes sense. Validity studies have problems, mostly because of that fake good that we talked about. They're trying to present themselves as better off than they are. Alrighty, so I'm doing a little debate with myself here. Yeah, we can talk about fitness for duty evals. We can skim some of this. I'm just talking a lot more than I usually do. An hour and 15. We are going to do an activity on Thursday, so it'll break things up a little bit. All right, so fitness for duty evals are, let's say there's an officer involved shooting. Let's say they are injured on the job. It's typically a life-threatening incident or under indicators that the officer is psychologically impaired. So it's typically their administrator will order an officer to undergo this evaluation and put them on desk duty, essentially, until they go through it and are cleared to go back out into the field. And there's two different models. One is that you would have the same psychologist perform this evaluation and then offer treatment if that person needed it. And some departments would have one psychologist who just does the evaluation and a different person who would then provide the treatment. And this avoids an ethical conflict between keeping the therapy confidential and also the fact that you have to give your report to the officer superior, right? Just like you do when you're doing a hiring report. So once again, I'm going to flip over to our handout here. There we go. And some of this, like I said, we're going to be able to skim because some of it is pretty similar to what we've already talked about. So essentially what this paragraph boils down to is like, you need to be pretty mentally stable to do this job, right? And anytime you're not, that can interfere with your ability to do this job well. It can put the public in danger. It can also put you and your partner or whoever in danger. So very similar. You have to be really well trained in this as a psychologist who was doing it. You have to know specifically about this type of eval. So you have to be licensed. You've got to have training in this, know about the literature of this, and knowledge of case law and legal requirements related to employment and personnel practices. Right now, you're essentially operating as part of HR, so you need to be part of that. Essentially, your practice should be this. They don't want the average clinician coming in off the street and doing this. This is so specific that you really need to be steeped in this to do this well. And again, you might have to testify, right? So you got to be ready to be that expert witness if necessary. Just like with the other type of eval we talked about, your client is not the person in front of you. The client is the agency that hired you or, might employ you. Sometimes these people are housed within the department, sometimes they're consultants. But you also obviously have to have a duty of care for the officer, particularly if they have been traumatized, right? You don't want to be callous to someone who might have PTSD. But you also need to make sure that it's really clear to that person that this evaluation result is going to their superior. And you want to avoid conflicts of interest. So again, it's better if you're not their therapist. If this person is your hairdresser or their wife is your hairdresser, there's this connection I was looking for, probably not, right? If you're buddies with this person, probably shouldn't do this. This is something TV shows get really wrong, I think, where you'll see people like hanging out with a psychologist and then being like, oh, now I'm going to come to you for therapy. Like, that's not how any of this works. It's not discipline. It's not supposed to be. It's basically, we have a legitimate concern about this person and we want to get them evaluated, again, for their own safety, for the public safety. You should have a documentation from the person giving you the referral of what's been done so far, what happened, why are they coming, if any sort of disciplinary procedures have been implemented, you should know about those. And so you should have all that information from them. Why now? And, maybe the precipitating behavior was just egregious, or maybe they can just tell, like, this person needs help right away. And FFDE, here is fitness for duty evaluation. So that's what that acronym is. So you want to get background and collateral information. So you might look at their performance evals, essentially their file. If Internal Affairs has been doing an investigation, you should be privy to that. You should look back at their pre-employment psychological screening, see if there were any red flags that you pick up on. I mean, often you're not the one who did that, right? So you might see something different. If there have been formal complaints against this person, use of force, again, officer-involved shooting, if this person's been sued, had disciplinary actions, if they're having flashbacks in the field, if they were, injured on the job, you should see their medical records, any other thing that you thought would be helpful. So often you request these materials once you get the evaluation. You have to have informed consent. They have to sign a thing saying, I know who you are. I know who this report's going to go to. I know you're not my therapist. So it's multi-method. So you're going to use interviews. You're going to use some of the same assessment techniques. You're going to review that background information. And this seems like, oh, you just have background information. But most of the time, this is what's going to take you the most time is that record review. So again, some of the same tests we've talked about, a face-to-face comprehensive clinical interview with a mental status exam, getting their history, the family, education. Are their attitudes reflecting bias and prejudice? Really important, right? You might do third-party interviews, you know, with their partner, with their superior. What are they noticing? And if you think, whoa, this is like way more than I can do. So let's say this person got a head injury on the job and you're not trained in neuropsychology. You're probably going to want to refer this person to a neuropsychologist. And there are forensic neuropsychologists who will do these types of assessments specifically. So basically, then when you write the report, you basically only include the information they know to make their decision. You don't need to, and send this here, by the way, you don't need to, you know, include any personal information that person might tell you that's not relevant. So the report should give a clear opinion of, are they fit for unrestricted duty? Or should they have maybe some time limited accommodations? Are they unfit for duty? Or maybe for temporary, or are they just, they should never be out on the street again, right? Obviously that's extreme, but there will be cases where that happens. And then of course you have to back that up based on the data you've collected about the person. If you can't get the information you need, you kind of have to say that and include a caveat that like, this is based on the information I got, but you know, I couldn't get everything. If you're going to say they're temporarily unfit for duty, you need to give recommendations after which they will be fit for duty. So again, a weird analogy or comparison to this is when I did evaluations before people had bariatric surgery, there would be people I would say, they can't get the surgery yet. They need to have 4 sessions of therapy before they do. Something similar would come into play here. They don't have to explain it to the officer. They give it to the department and they go from there. If the department wants them to give them the officer feedback, you can do that. But typically you just hand it off and then they deal with it. In terms of legal considerations, you want to just keep everything documented. Any kind of contact you have with that person, phone, email, what have you. They have to, again, safeguard confidentiality, and the law enforcement agency has to do the same. And they have to stay up to any sort of changes. And again, similarly, let's say the department gets sued, they need to be ready to defend it in court. Alrighty, so we'll talk briefly about training on Thursday, and then we're gonna watch a pilot episode of a TV show and do an assignment based off of that. So I'll do my typical sticking around in case anyone has questions. If not, I will see you all on Thursday.
Thank you.